changemaker is somebody who can identify a need in an environment and can bring their experience and their resources to bear to try to address that need.
So I think a changemaker is really about fostering change and growth in the community, and you do that by identifying different paths.
Anyone can be a changemaker because change starts from a very grassroots kind of level, even just helping one other person.
What Ronda has done is she has seen where in her state there was need. And she has worked then hard to help to provide those resources.
She came from a background in rural Arkansas. Her family was poor. She saw people not getting the kind of care they needed. And so she's very concerned about trying to treat everyone equally and giving good care to every patient.
She started mobile mammography in the state of Kansas. That made a huge change for women who couldn't otherwise have a mammogram.
She has been involved in disparity committees, and this gets into administrative type things, of the National Institutes of Health, the National Cancer Institute, the American College of Surgeons, and the Society of Surgical Oncology. Those are all the big groups that really develop protocols and management things for breast cancer and other cancers. And she's worked on disparity there.
You know, she's also gone to Africa, bringing newer techniques, helping people train, teaching people how to do better surgeries. She was interested in healthcare disparities and in helping the underserved and in being a role model and advancing women of color in medicine.
Diversity is important in academic medicine. We had never had a black female surgery resident, and she was the first one we've had, and she did an excellent job. So she changed kind of the attitude in our surgery department.
But meanwhile, also, she has managed to be a very successful mother. You look at her YouTubes and she's talking about reading science books to children. She's done a lot outside of medicine. So she has had a life one should aspire to, and that is inspiration.
Congratulations to Dr. Ronda Henry-Tillman, a person that I look at almost like a second daughter.
True is very vibrant, very exciting to be around, and just always wants to help and know how he can improve.
Drew is a great example of somebody who excels in terms of his own work, but also is able to come back and creating different initiatives.
It's been an honor to know True for the past 6 years since I joined the San Diego Festival of Science and Engineering. True has played an integral role in being one of our primary volunteers for Expo Day. And with True being a first-generation member of his family to go to school and graduate, it's so inspiring for us to have him out there talking to the students and sharing his story.
Drew and his wife has founded a foundation. It's called STEM Uplift. And the goal of the foundation is to provide funding, scholarship. He's trying to address the resource issues that is so important, bringing STEM into an underrepresented community.
True is really motivated to give back because of sort of the path that he came from to get here and the success that he has had, and the diversity that True has taken is a true example of what our children and our students need to see, because they need to be able to see themselves in him, and that any path that they take can get them to dream big, and he's really an inspiration to pull that all together.
True, congratulations. We really appreciate all of the effort that you have done. We're looking forward to work with you in many, many years to be able to bring more resources to the STEM field, as well as to bring our students, our UCSD, into the next level. Thank you very much.
We've had students in psychology for a long time who aspire to careers in clinical psychology, in counseling, and therapy. But we haven't been able to create hands-on experiential learning in this area of clinical psychology until Mr. Edelman said, this is the kind of thing I care about, this is what I support. So it brought together faculty, staff people from psychology, from psychiatry, to really think what would be a good education in the area of mental health, clinical psychology for undergraduates.
His gift has enabled for the health system and the psychiatry department, the medical school, to work much more closely with the campus side for the benefit of our students. In 2004, when I became chair of the department, we were seeing maybe 50 or 60 kids in our services. Now we're seeing 750. That is a huge increase, and a lot of it is due to Mr. Edelman's priming the pump. He, in 2005, funded some new therapists and part of our psychiatrist leader position to help us set up this collaboration.
For me, it's about how Mr. Edelman's own journey as a biotech entrepreneur has provided this funding and changed the lives of so many clinical psychology students and affected all of our individual journeys.
If it weren't for him, I don't know how soon we would have started doing this, but he saw the value and he immediately offered his support, and for that we're very grateful.
Congratulations and thank you to Mr. Edelman, who opened doors for me to be able to help others and make a real impact on others in my lifetime.